Hello, my name is Elizabeth Carl. I'm a registered nurse currently working at the ED at Strong West. So this is my empowerment activity for week 3. So the 21st century nurse educator. The nurse educator has many roles, and in making up this graphic, I actually use the nurse educator in the clinical setting and the nurse educator in the academic setting. So both of these, some of them will actually overlap, but some pertain more obviously to working in a university or compared to working in a hospital. So the nurse educator, the graphic here is everything on the left-hand side of the screen here is what I consider to be in the clinical setting as a nurse educator. On the right-hand side is the academic setting of a nurse educator, and in the middle are those tasks that overlap. So starting on the right-hand side, as a nurse educator, you obviously are doing a lecture as part of your job description. So you're providing materials for your students in lecture. You also want to make sure that your lecture is interactive. You don't want to just do the age-old PowerPoint, which is what I had when I went to nursing school. That's no longer how you actually educate your students. Now you want to make your PowerPoint presentations interactive and more interesting for your students. Another aspect of this is actually nursing students. So obviously as a nurse educator in an academic setting, you will have nursing students that you are working with on a daily basis. And as a nurse educator, you have the ability to provide a great foundation for these nursing students to build the rest of their nursing career on. You have the ability to impact them, possibly into what career field that they will go into. And that's something that I don't think should be taken lightly. Another one is the clinical. As a nursing educator in a academic setting, you are responsible for a nursing clinical. Again, this is where you can start nursing students and develop public care for their patients. You can be a great role model to nursing students as to how they should care for their patients and interact with their patients. Show them the appropriate techniques that need to be done for items such as starting an IV, to hanging fluids, to giving IM injections. And lastly is curriculum development, which as a nurse educator is obviously part of your job description. Curriculum needs to be ever-changing along with healthcare ever-changing as well. So nursing curriculum from 10, 11 years ago when I went to nursing school has obviously changed from now. You shouldn't be teaching the same curriculum. On the left-hand side, in the clinical setting, you have career advancement. So as a nurse educator in a hospital, you're responsible for, at least on our hospital, the nurse educator is responsible for approving if a nurse wants to go for their next nursing level. So your project needs to get approved by the nurse educator, and then you actually have to present to the nurse educator in order to be awarded your next nursing level. Another part of that is training your staff. So training staff is not only new nurses on your unit, it's also your current nurses that you have on your unit. So what I mean by this is new nurses, you obviously have competencies that they need to get signed off. You're going to need to pair them with a preceptor. An important thing in pairing them with a preceptor is you want to pair them with a preceptor that actually wants to precept. The worst thing about having a preceptor that doesn't want to precept is it's a horrible experience for the new nurse, and you don't want to set them up for failure coming onto your unit. And you also have training that you're going to do with the nurses that are on your unit. This can be done by in-services, skills days, education days, in-services, that kind of thing, to just keep them up to date on any new changes that have come out, any new policies, procedures. It's a great way to ensure that they're competent in doing the skills that they have to do. By some of them that they don't do on a daily basis, do a yearly skills day just to brush them up on their skills. And in the middle is the tasks that are relevant to both nurse educators in both settings. So you've got research. So obviously as a nurse educator in an academic or hospital setting, research is important. With all the advances that we have in healthcare, there's always new policies, procedures, techniques. And as an educator, you need to be looking for those new techniques that will help streamline patient care or make for a better patient experience. And that's important to relay to your staff. Meetings, those ever encompassing meetings. So in both settings, you'll have meetings. So With a clinical setting, you might be part of a committee, such as like a pediatric education committee that will meet every so often to discuss things such as, pediatric service orientation, what new changes are coming out, that kind of thing. Meetings in an academic setting could be with students. You're meeting with them to let them know how they're advancing in their class. Meetings could also be with other staff members, such as curriculum development. Obviously, you're going to work together with your department to create a new curriculum. It's not something you're going to do completely by yourself. Evaluations are obviously done in both. In the academic setting, you'll obviously meet with your students and do evaluations to let them know how they're doing, especially in the clinical setting of a hospital. You want to let them know, especially if they're not doing well, to give them that feedback right away so that they can improve on their performance so that they don't fail the entire course. And evaluations, as an educator in a hospital, you're going to give feedback to your new nurses, if there's things that need to be improved, things are doing great, how you can help them, get through their orientation, that kind of thing. And then lastly is education. So even though you have your advanced degree, you want to encourage your students or your fellow nurses to go for their advanced degrees. And as I said, you want to provide education for your nurses as frequently as possible, just to make sure that they're all up to date on everything that's, every new change that's new out there. And then the last slide is the future of nursing education. So this is how I see the future of nursing education as pertains to how it impacts quality and safety. So you want to ensure that your nurses have their competencies completed pertaining to the unit that they work on. So at the completion of orientation, your new nurses should have their competency signed off on. Obviously, not everything can get signed off all at once because sometimes you just don't do certain procedures all that often. But they should have a majority of their competency signed off and be ready to work on the unit. Provide yearly skills day to nurses so they can demonstrate their competencies and provide valuable education to the nurses. Promote current evidence-based practice standards. Ensure nurses complete mandatory yearly education. This is a big thing. There's so much education that gets pushed out throughout the year, and some of it's, a month before the end of the year, and they have to get it all done. But as a nurse educator, you want to make sure that they have that done because there's important information in that yearly education that gets pushed off out to the rest of the staff. And then lastly, provide in-service, especially if you get any new equipment, procedures, or policy changes. You want to provide those in-services to reinforce what was already sent out so that you're making sure that if any of the nurses have any questions or concerns about those new policies, procedures, or questions about how a new piece of equipment works, this is the time for you to go over that with them and address their concerns. Thank you.